We're standing by for Lillian Posadas, our hospital administrator, who will have an update for us. But I think she's wrapping in a meeting, which is making me kind of nervous. So we're going to move on to our next thing here. In the meantime, we have in our K-Wave News Zoom room from the Guam Chamber of Commerce, Christine Boleto. Good morning, Christine.
Good morning.
And then we have from the Guam Hotel and Restaurant Association, Mary Rhodes. Good morning, Mary.
Up day. Good morning.
And then from the Guam Women's Chamber of Commerce, we have Eileen Agahan. Thank you for joining us, Eileen.
Thank you, Chris and Sabrina. Good morning, Guam.
Good morning.
Good morning, Guam! Sorry, I always say it with my chest. But let's just jump right into it as we are anticipating finishing out this week in a PCOR 1 style lockdown. I want to just go round robin, and if you guys could, and I know this is a loaded question, what are your members saying about the current restriction on businesses opening? I mean, I can kind of figure it out, but let's just hear it straight from you ladies. And we'll go ahead and start with you, Christine.
Well, as you know, Chris, we've been very vocal about how our members feel and how the chamber feels about moving to PCOR 1. You know, we've said that, you know, we understand and respect the governor's decision, but, you know, as a business community, you know, we're seeing more and more businesses close their doors. You know, we're hoping, we're getting started this week with the business advisory groups and pulling folks together. One of the things that we're starting to talk about is instead of essential versus non-essential businesses, looking at high risk versus low risk, looking at businesses that don't have face-to-face contact and allowing them to open. You know, we definitely feel there's opportunities for us to work with the administration and public health on reopening safely, and, you know, keeping the health and safety of our people in mind, but giving businesses a chance to reopen and to get their people back to work. And so, you know, like I said, we've been very vocal, and we're hoping this week we'll have more dialogue at looking how we can start that process and start reopening our businesses.
Mary?
Thanks, Chris, for the. I think as we go into our third week of PCOR 1, or moving back to PCOR 1, I know during our last interview we talked about how we really should have gone to PCOR 2 with more limitations. I think that we need to redefine some of the criteria that is between PCOR 1, 2, and 3. Like Chris said, I think there are opportunities to revisit some of the way the businesses are identified. I think we're getting better at identifying where the clusters are and where what the data is showing us. And so now that we have more information, I think that's an opportunity with the government to look at ways to really focus on the areas that need attention and really come up with criteria that, again, are low risk, high risk, but at the same time, areas where we need to, where businesses can operate safely and efficiently, and where people really need outside of basic essentials like, you know, power, water, telecom, food. They need other things right now. And I think the businesses in general are also looking for assistance outside of what's already been provided. We're going on 6 months. So I think that businesses have really been exhausted as far as where their funds can take them to be sustainable. I think that if CARES Act money is still available, we can redirect some of that funding to assist businesses even further. But more importantly, what are we doing with those who are currently unemployed? I think that this is a window of opportunity where we can take some of those unemployed individuals and get them to be trained while they're waiting to go back into the workforce. I had contacted Guam Department of Labor Director Dave De La Sola this morning because last week during the GCC conference, they mentioned $12 million in funding, which The grant hasn't been approved yet, but that's a place where we can actually train people and upscale them, which is what we've been talking about with GBB. Is what do our employees need, our furloughed employees need to get back into the workforce? So let's use this time. If we are going to stay in PCOR 1 or move into PCOR 2, what can we do with the current unemployed population to get them retooled and retrained to get back into work?
Right on.
Two, what can we do for employers as they're waiting to go back into PCOR 2 or PCOR 3? Is there additional funding we can do outside of what's been provided through the small business assistance programs? Is there something that we can do with rent, power, utilities? I know that we've asked them to do a deferment program, or they came up with a deferment program, but what about a forgiveness program? I think that we need to look at additional programs that can truly help people if we're going to extend this out any further. I think we're at a place where we're really at that, where the rock and the hard places, where we have to make some brave decisions on how to get people out of a very low area of a big area of concern, but a low area of how they can move and mobilize their businesses, whether it's through their product, services, or their employees. So I think we have to be more creative and provide the resources necessary for business to get out of this, and opportunities for individuals to really feel like they're progressing. If we want to them, I think that's we could do that in the next month to get them prepared to go back into the workforce.
Okay, Eileen.
Yes, just adding on to what Christine and Mary had mentioned, the Guam Chamber of Commerce has also submitted similar recommendations to the Business Recovery Task Force, where we are encouraging businesses and government agencies to operate contactless as much as possible. And a lot of transactions now can be processed online. We're trying to look at more solutions and ways of, to support our businesses during this time. And mainly the theme is, how can we pivot and start to be creative, and how do we transform our businesses, during uncertain times like this? So, we're noticing a lot of our members having the need for funding, and our focus is really to provide resources, and we've done this in the form of topical town halls, getting the resources out there as much as possible. So we've also been collaborating with our resource partners, both local and federal, to host roundtables and discussions on how we can support our businesses, the different industries. For example, childcare, that's one big concern for many of our members. So our focus has been on that. How can we support homeschooling in the form of tutoring services, distance learning? So we look at it from all angles, and we're definitely with the GHRA and the Guam Chamber on this, is how can we move forward and promote new ways of conducting business.
Right. Let me just ask you ladies this, because I feel like I want to say that all of you or your organizations respectively have seats at the table when we talk about the economic panel of advisors, the recovery panel of something. I'm sorry, God, I don't want to. But basically, I got chewed out.
I think has been dormant for the last 3 weeks. Right. But just yesterday, I met with a few of our members, and we have a meeting coming up this week. I think in the last 3 weeks, there's just been no economic activity, so there's been no discussion. But now again, we're looking at moving forward, and we're pulling together, and we're hopefully going to come up with a platform that we can introduce to the governor and seek her approval at ways that balance protecting the health and safety of our people and getting our people back to work.
Right.
Why has it been dormant, though? I mean,
yeah, because I got my head bit off when I asked the governor Friday, and I just want to ask you ladies, since I'm not sure if you actually sit on these panels yourselves, but I know your groups are represented. Is it a thing? Is it a thing that we're sitting here in this pandemic and, some people have been tasked with looking beyond it? to help us recover economically. And is it a thing that we haven't met in 3 weeks? We haven't met in 5 weeks? I mean, just not meeting on this at all. And who's
Well,
responsible?
the
Because
head
the governor had said that, you know, the people on these panels, they're all leaders and they should be meeting on their own. And I'm sure you saw
Well,
the video.
I wanna kind of make the distinction. So with the advisory groups, both the business and the one that's the smaller group to the advisory panel, Ken Cook, you know, is our head and leader, and so he's the one that generally calls those meetings together and pulls us together. With respect to our different organizations, we have been meeting. You know, I know that the Guam Chamber, we've done. You know, the think tank, I know GHRA and the Guam Women's Chamber, as well as all the other respective business organizations have been meeting on their own and having these discussions. And, you know, we've just recently formed a political action group where we're pulling together as a group and discussing, you know, these economic initiatives and how we need to move forward and what we need to do to rebuild our economy. So there's been meetings in the respective groups. There's been meetings together with respect to the economic advisory group that is part of the government or is supposed to advise the governor and the administration. You know, again, that's just been called. It's not led by our business organizations.
So who called the meeting then for, as you said this week?
Yeah, we have a meeting later this week
Oh, that's good.
or midweek.
Who called the meeting?
With regards to recovery advisory group, there's an economic advisory group, but there's also a recovery group like with the GDB, with the recovery plan, and they meet about every 2 weeks. We have one this Wednesday as well. So the GDB one has been pretty consistent with every 2 to 3 weeks, but for the other one, there has been some time in between, but we are reconvening this week.
That's a nice way to put it, Mary. There's been some time in between. Eileen, your thoughts?
Yes, so I know our president, Holly Rustick, has been an active participant in the Business Recovery Task Force. And within the Guam Women's Chamber of Commerce, we also have our internal recovery working group. So we are hosting regular meetings where we pretty much discuss with every change in PCOR, how can we assist our members further? Again, looking at ways, you know, they can recommend, we help our members in, you know, sustainable ways of how we conduct business. So a lot of the discussion is, again, back to the contactless operation, facilitating, for example, curbside, pickup delivery for retail businesses, for service-oriented businesses. A lot of it can be by appointment or it can be done online. So we actually polled our members and we've seen that many of them have already started to develop more online products or virtual products. And a lot of them are starting to sell and take payments online. So again, we're already starting to see that shift in how we do business on Guam.
All right. On that note, ladies, we're going to have to ask you to hold briefly as we now have a hold of Lillian Posadas. You know, we're always having this conversation about COVID and positive cases and people dying and the risk and the, you know, but everything dealing with that. But I just think, to be fair, we can also have these other conversations about opening businesses and discussing what the plan is, right? Because damned if you do, damned if you don't. If we don't plan, we get mad. If they plan, we get mad. And so I always think it's interesting for a lot of these businesses to kind of navigate the territory of, you know, discussing, I mean, the very real and valid issues about a business that should and, you know, maybe will be allowed to open. So we'll just jump right. Go ahead.
I wanted to just follow up on what you guys were discussing earlier about this this new kind of criteria, the high risk versus low risk, and changing, I guess, the mindset from the essential non-essential.
Right.
And have you guys spoken with public health about this? And were they receptive?
This is Mary. I've spoken to the infection disease control administrator, as well as, you know, in the past with Dr. Jana and other individuals within public health on what kind of criteria would be looked at when we first started. And I think, you know, a lot of this has been fluid. But I think, again, now that we have a lot more data, especially about where, you know, the transmission has taken place out in the community, what has been really the problematic areas, I think that's where we can kind of press the reset button and use more of that data analysis to make better decisions. So I think it's really, we've gone kind of beyond just talking about what we could have done versus where we should be going. And I think that's the conversation that needs to take place going forward. And in fact, that's why even GHRA, we're having a meeting next week, a virtual meeting, because we're pulling together with MALU and Department of Environmental Health, because I know it's a difficult discussion, especially after hearing the numbers with GMH. And of course, everybody is empathetic to the situation we're all in, especially those families who are more closely affected with COVID. But we have to understand about really the rules of engagement between PCORs 1 through 4, because regardless, there are still businesses operating and employees out there in the community, whether you're government or private sector. A lot of these businesses who are still considered essential or low risk, I think that, you know, there are still people working, and there are people who are worried about things. So the topic that we have next week is, I did an analysis of the public health website of how many businesses actually submitted their plans for PCOR 2 and PCOR 3. And Malu can speak to this a little bit more, but only 200 companies are listed on their website as submitting a plan. And that seems to be the number one reason for some of those closures when they actually did their enforcement, was people didn't have a plan. They didn't submit it to public health. So we want businesses, if they're currently operating today, or if they're planning to operate during PCORs 2 or 3, that they need to submit their plans in. And there are guidelines already out there that Chamber of Commerce had worked together with Women's Chamber and the Economic Advisory Group to develop these guidelines and submit it to public health. So with compliance and enforcement, the plan is the number one thing. The signs outside of your establishment was number 2, and number 3 was really the safety guidelines, especially with masks being required. So a lot of them are pretty basic, but very essential to remaining open once we reopen, because we don't want to keep going back and forth between PCOR, and we need to make sure the businesses are ready to reopen or continue operating if they're already open. And so as much as it is hard to talk about the economy, businesses are operating today. And regardless of which PCOR you're in, I think that we have to address these issues, because it's our jobs as member trade organizations to make sure that the businesses have the information they need and the resources and the tools they need to remain open during such turbulent times.
Right, and I want to take this over to Christine and Eileen and just ask the question, what additional businesses, whether we want to call them essential, non-essential, low risk, high risk, or, you know, red, blue, green, pink, whatever, what additional businesses do you believe could open safely today during this PCOR 1 lockdown?
Well, I think that, you know, what we've demonstrated, and speaking to what Mary talks about with regard to the data, the contact tracing and the results of that are really important for us, because it tells us where these clusters originated from. How did we reinfect our population? Because obviously we were doing a good job for many weeks controlling the virus spread, you know, within the community. And so, you know, from what we understand, this was initially introduced from an off-island party that came and didn't comply with the quarantine. And so for me, that's important, because that's how we target making sure this doesn't happen again. There were some spreads in the businesses, and as Mary talked about, we have safety health guidelines that need to be followed and need to be followed religiously. What can open? You know, we've shown through grocery stores, retail. we're the distancing, the compliance, it's there. We look at professional services by appointment only, controlling, who goes in and out, and controlling, interaction, non-contact, businesses that service their customers, those can open. So, we want to look at starting first with those that can safely open with limited contact with the customers, and then move towards reopening some of the establishments that have those control measures and proven that they've done a good job. And then we can talk about the rest later, but we have to have a plan. We can't continue to have a complete shutdown until the end of this year and have nothing operating and no means for which people to support themselves at the end of December. We hope that there's additional funding coming, but if there's not, how do we help our people? How do we help them feed their families? And we've got to think there's a balance between health. Yes, we need health in order to have a healthy economy. But once you have your health, if you can't feed your family, if you can't have a roof over your head, if you can't pay your bills, we're already seeing the mental health effects on our people from those kinds of concerns. And so, I think that's important for us to have the discussion, to be sensitive. I've had in an indirect way, one of the deceased was a friend of mine, and it is hard, but that doesn't mean that we have to stop living and crawl into a hole and not have at least these discussions and a way forward.
Eileen?
Yes, we actually support the same recommendation as Christine had mentioned. Mainly, if a business or government agency can operate contactless and within a low-risk environment, then yes, we fully support that recommendation. And again, safety does come first, but of course, we need to find ways, for business to still thrive in this type of economy. And so we're constantly having our internal recovery group meetings to consistently explore ways and solutions to support business. So of course, they are one of the primary sectors that drive our economy, our small businesses. So yep, we're going to work together, all of us.
Wow.
We're in it for Guam.
Well, thank you guys for coming on, and we look forward to getting a debrief on the meetings that you're going to be having with this economic recovery panels and who called the meeting?
Sorry if I got you guys in trouble. Did you get in trouble?
No.
Yeah, you did, Christine.
Ken Cook called the meeting together, and so we're appreciative with pulling us together and starting back up the dialogue.
Mary, did you get in trouble?
No, like I said, GBB's been having their meeting every 2 to 3.
She's like, I'm good. I've been done having a meeting.
No, there's no one getting in trouble. I think it kind of brings things back to focus, right? I think that it's, again, but now we have more data. Now we have more things to work on. And now's really the time for the heavy lifting. And like you said, move from plan to action. I loved your question about the plan to the Gov, because although there were plans, if plans shift, you need to be able to adjust your actions and your reactions to things. And I think we really have to look at the criteria again, like Chris said, and just start making changes so we can really make improvements and do things better.
Right. Hey, if I got to get chewed out just to move things along, totally willing. Throw me in with the sharks. I don't care. Let them take a bite. But at the end of the day, if it moves things forward, which it looks like it's doing, then we're happy for that. Eileen, we're going to give you the last word.
Sorry, Chris, could you repeat that again?
Yeah, just last word, if you will. You excited about having a meeting this week?
That would be Holly. So she is our main representative. So more likely she'll be sitting in. She has been representing our board of directors at the task force meeting. So we do collaborate very closely.
Right. And Christine, Mary, we're bringing on Department of Environmental Health. We've got Tom and Malou from there. And then I think we're also going to fold in Janella from the PIO at Public Health. So, I want to kind of make this a regular, let's have our own meetings.
Yep. Right
here on the link, okay? So we'll set something up again for next week. You got
Yeah,
it.
we appreciate you